Hi, this is Dr. Frezza at the Chiropractic and Injury Center. Today we're going to be talking about ICE, or as we like to call it, the ICE homework here at the office. We usually give the ICE homework after the initial visit. We've just taken some x-rays, we've done our consultation, and we tell the patients to do their ICE homework. My homework then is to mark their film so that when we bring them in next time, they can give me some feedback on the ICE, and I can give them some feedback on their x-rays. But what the ICE homework is, has to do with inflammation. One of the things we treat as chiropractor is subluxation, which is a misalignment. And one of the things that you get with the subluxation is you'll get inflammation. So think of inflammation like if somebody sprains their ankle. You sprain your ankle, you put a hot pack on it, it blows up like a balloon, right? That's the inflammatory process. It's kind of the way the immune system works. Same thing can happen in the spine. When two bones move out of position, right? You've just created space. Well, nature abhors a vacuum. You create space and it fills it with fluid. And fluid is painful. I always use the example of medical doctors. Someone comes in and their knee is swollen, what they would call water on the knee. They go to the medical doctor and he draws the fluid out with a needle, and instantly the pain goes away because fluid causes pain. So we want to do the same thing, but we want to do it with ice. Again, the inflammation is there, the fluid is there. The bones have moved out of position, that's subluxation. So what I do is I tell the patients to go home and get an ice pack, okay? And you want an ice pack that has a little bit of length to it, because if it's the neck that's bothering them, I have them drape the ice pack around their neck like they would a towel. If it's the low back, I want it below the belt line on both sides, okay? And the idea is ice is a constrictor. So while you have the ice on, the muscles will tighten. And I tell them to put the ice on for 20 minutes. Then I tell them to take the ice off for a half hour, give the muscles a chance to relax. Then again, take that ice pack, put it on for a second 20 minutes, the muscles will tighten. Off for a second half hour, the muscles will relax. And then a third time, on for 20 minutes, and then off the rest of the day or night. That is called pumping edema. Edema is fluid. Think about squeezing toothpaste out of a tube. Tight, relax, tight, relax, tight, relax. Any fluid that's in the joint space, we want to push it out of the joint space. And then just like the needle in the knee, but we don't need a needle, as the fluid level begins to come down, the patient begins to feel better, okay? It takes 3 days of ice homework for that fluid to start to come out. So I usually have them do it the night of that first visit and then 2 days thereafter. I also have them drink plenty of water in case there's a lactic acid buildup. We want to make sure that they're kind of using the water to push that lactic acid through so that the person doesn't get sore. That's the ice homework. And what we do is we have the person come in. If they've done their homework, we'll have information to tell me. How are they feeling? Did the ice make a difference? And then what we do is we sit down and we go through their films with them. That's how we normally do the ice homework, that first visit. But then what I do is the first probably month of care, I make sure that the patients get that ice homework on the nights of each adjustment. Again, any fluid that wants to accumulate, we want to make sure that we're pushing it out of the joint space. All right? So that's the ice homework. I appreciate you guys for watching.